Chin augmentation is a procedure that I get very excited about because the chin plays such an important role in making a face look good. If your chin is less than ideal, then it can limit the attractiveness of your face. But the good news is that chin augmentation procedure is safe, predictable, and minimally invasive. So the anatomy of a strong chin. A strong chin should bring proportion and balance between the upper and lower parts of the face. It can also contour the neckline. And in general, a strong chin is associated with character and overall attractiveness. And this is the design of the implant. It's silastic, it's soft, it's tapered at the edges, and that helps it contour with your natural jawline. And because of this tapering design, it blends in with your natural jawline. And we'll see that in this example. So this is a young woman who wanted to strengthen her jawline. We place the implant through a small incision, less than an inch, and that's placed underneath the chin. And the implant rests along the jawline. And in addition to augmenting the jawline, it helps with the shadowing seen in front of her cheeks. And here we can see her with her final result, and she has a nice, natural, strong jawline. On a side note, we also did some fillers underneath her eyes. So how is this done, chin augmentation? Well, it's an outpatient procedure. It's usually done under general anesthesia, and it takes about an hour to do. And you'll see that it can be helpful for individuals that really need a lot of chin augmentation, but it can also be very helpful for someone who has an average chin but maybe wants to make it a little bit stronger. And here's an example of that, where his chin before was pretty good, but it's great after the surgery. So another benefit from time to time of chin augmentation procedure is it can make for a younger appearance. Here's an example of a woman who had a chin augmentation procedure, and we did some liposuction at the same time, and she looks maybe 7 to 10 years younger. And here's another example where we've really improved her neckline and the entire lower third of her face. Another example of improving facial proportion, this is for a younger patient. She was 17, and we can see afterwards just a beautiful oval shaped face. Before the procedure, her cheeks looked a little large and her nose seemed out of proportion, but now everything looks great. And from the side, this is a week after the surgery. We can see some tape underneath her chin, and she's had a very fast recovery. So in summary, the chin is very important for an attractive face. The procedure to augment the chin is either done surgically in an hour on an outpatient basis, and the recovery is a week. And currently we do have non-surgical options which are almost as good as the surgical ones, which involve using fillers along the jawline. So that's it, and thank you for your attention. So here's a little known secret. The cheeks are key in making attractive faces. Having strong cheekbones helps make you look younger and better. And the incredible thing is that we can currently augment your cheeks here in the office in about 20 minutes. So today I'd like to talk to you about how we do that. So cheek augmentation is something that can be done in the office with fillers. Cheek augmentation can help reduce the shadowing under the eyes. It can make faces more attractive in general and can help them look more youthful. So let's look at an example of treating the cheeks in the tear trough area. This is a woman who had some shadowing under her eyes, and we have used fillers both to treat her tear trough area and the lateral cheek area, and those two areas combined have given her a refreshed and yet natural appearance. So what are the fillers? The fillers are a gel-like substance that's normally found in the skin. One of the first fillers, Restylane, was first approved by the FDA in 2003. And fillers are used to reduce wrinkles, fill grooves, and to contour the face. So what do we mean by contouring the face? Well, fillers can be used a lot like makeup has been used, where a makeup artist may use makeup to highlight an area or contour an area by changing the shadows and the light reflection on the face. Fillers can go one step further and actually contour the face by adding peaks to the cheeks or areas that we want to enhance, and thereby reducing the areas that we want to de-emphasize. So here's an example of that, of cheek contouring. This is a hairstylist in her 30s, and she was noticing some shadows under her eyes. And here she is after the treatment. You can see we've augmented her cheeks, and she still looks like herself, but she looks fabulous. And this is her looking the other way. And again, we've treated both the shadowing under her eyes, but we've also augmented her cheeks. So how are these filler treatments done? Well, the filler treatments are done in the office, and with every patient I have a very careful analysis. I examine them under a magnifying lamp. We take digital photography and examine their face on the computer screen, looking for every detail, and I give them both surgical and non-surgical options. So here's an example of using fillers to actually turn back the clock or make a face look more youthful. This is a woman who had begun to run recently, and she noticed some weight loss. She saw some advanced aging, and she brought in this picture of herself from 9 years prior. So after our filler treatments, and this is a combination of treatments, we've done fillers to her cheek, Botox to the forehead, and some fillers to the chin. And when you look at her before picture from 9 years ago, you can see we've gotten her pretty close to that, and in some ways even a little better, because her cheeks are more prominent than they used to be. And here's a frontal view showing her fresh look. Another example of a patient looking for a refreshed look, and again, by treating her cheeks and under her eyes, we were able to make her look more youthful and make her look on the outside the way she feels on the inside. So this brings me to a point that comes up. A lot of patients ask, well, what about my nasolabial folds? And this shows the evolution of my thinking about fillers for the face. This is a patient shown in 2004 with deep nasolabial folds, and we see her here in 2006. After 2 years of treatment, we had really gotten those nasolabial folds away, and back at that time I was really proud of this result and had it on my brochures, my website. But in 2010, we began to turn my attention away from the nasolabial folds in more of an upward direction and treating under the eyes and the cheek area. And I think you'll agree that she actually looks better in 2010 than she did in 2006. So I think in answer to the question of nasolabial folds versus cheeks, you can treat both, but the emphasis should be on the cheeks and then treating the nasolabial folds second. So in summary, having strong cheekbones can be very helpful in keeping faces look young, healthy, and fresh. I hope this video was helpful. Thank you for your attention.
Hello, my name's Adrian Richards. I'm a plastic and cosmetic surgeon based in the United Kingdom, and I'm the surgical director of Aurora Clinics. Today I'm going to be showing you a procedure in which I insert a perma-lip implant into a patient's upper lip. This is a permanent silicone implant which I'll show you. So here I am. This patient's actually having a facelift procedure at the same time, but I'm just measuring the upper lip, and then I just mark exactly where I'm going to make little incisions in the corner of the lip here. Next stage is really just to mark this. This is the line where I want the perma-lip implant to sit under. just some local anaesthetic going in to numb the area. This lady's had a general anaesthetic, but 90% of the cases I do of Permalip are under local anaesthetic with the patient awake. It was just this patient was having another procedure, so elected to have the Permalip inserted during this procedure. So that's just the local anaesthetic going in, a bit like the dentist's. Just tiny little incision in the corner of the mouth here. You see I'm just going through there. Again, this will be painless with a local anaesthetic, and then the next stage is just to gently make a little tunnel in the lip here where I'm going to pass the Permalip implant through. This is the Permalip implant. She's elected for the medium size one, and you can see here I've just grabbing the lip implant, and now I'm just going to gently pull it through into the upper lip, and this is the technique, just to gently pull it through the tunnel I've already made. So you can see that sitting there very nicely in the middle, and then I just centralize it, just make sure it's absolutely lying in the center. Very important for the patient to massage this area just to make sure that it's centered in the first few days following surgery. Then next stage is just put some very small absorbable stitches in the corner of the mouth, which I'm doing now. These don't need to be removed, they fall out on their own. Straight after the operation, very important, we apply ice packs to the lips to limit any swelling. Normally swollen for about a week, no permanent sensation changes. The lips function normally, but just swollen for a week or so. Here's some results. As you can see, this lady's had upper and lower lip Permalip implants, and it gives you a sort of much younger, more youthful looking, fuller lip. And so it's really quite a straightforward procedure, and it works very well. So if you'd like any information about Permalip or any other form of plastic or cosmetic surgery, please contact us either via the website, which is auroraclinics.co.uk, or by phoning us. So thank you very much for watching the video. I hope you've enjoyed it, and we look forward to seeing you soon.
Hi, I'm Dr. Michael Schwartz, and we're going to take you through a video of a young woman here having her upper eyelids done. We've broken these down into 10-minute segments for convenience viewing, and this is really the upper eyelid portion, although she's had her upper eyelids, lower eyelids, a mid-face cheek suspension, and a mid-face lift done, and we're going to be showing you those separately. In a sitting position, I carefully measure the line or the distance from the eyelashes where I want the final scar to lie, and I want that to be perfectly symmetrical on both sides. Most people are not born perfectly symmetrical, as the face forms in vertical halves. Most often the orbits where the eye sits are different sizes. The eyelids can be different shapes and sizes, and there can be varying amounts of excess skin, also related to how much the brows are drooping on either side, or the actual position of the brows. What I do is make sure the lower limb that we're now cutting is at the same distance from the lashes, and then the skin to be excised, and subsequently the upper line that you see is a little bit variable, but I also am really cautious about making sure that somebody can easily close their eyes. So she has her eyes closed in sitting position, where I'm marking before the surgery the amount of skin that's going to be taken out. Here we're making the incisions. I don't think it's readily obvious, but I bevel the incisions out. The lower limb goes out this way, the upper limb goes this way, and then, as we'll see at the end, I want those edges to be perfectly apposed and everted, because with healing comes contraction of the scar, and if they're not everted, they're likely to indent. So I want the scar to be perfectly flat and heal so that it maximally disappears. And we've planned it so that it goes into a natural skin tension line. As you'll see during the closure in a woman, I like to arc the incision up and outward at the lateral aspect of the eye to simulate how makeup's put on. It also enables me to trim skin here and get some better tightening of the outer area of the eye and avoid a droopy or hooded look out here. I think that's a really great technique when planning the skin excision in a woman's upper lid. In men, it's really important to not do that. I see a lot of men with feminized upper lids, and I'll talk more about that in a minute. Here I'm removing a small additional strip of muscle that was left behind. I'm now going to cauterize the wound bed even further with a needle tip cautery. This is an electrocautery needle tip, very precise. We can cauterize on low power vessels that are really close to the skin edge. We don't want to cauterize the skin edge at all because obviously we don't want to burn the skin. I'm now going to have my assistant retract the skin at the medial aspect of the lid. I've taken some scissors and just bluntly spread in there while gently pressing on the eye to cause the fat in that medial compartment to pooch out a bit, if you will, and then we'll clamp it, trim it, and cauterize it with the bipolar cautery. I can demonstrate that fat if I close my eyes and press on my eyeball. You might see a little puffiness, or a lot of puffiness in my case, in the medial aspect of my lid, and that's what we're trimming here in this patient. We don't want to overdo that. You don't want to have a hollow eye appearance, and I carefully evaluate everyone before surgery to make sure that they need that. If someone has deeper set eyes and they don't have a lot of fat there, depending on each person's anatomy, I might not remove any fat. I might remove a significant amount or just very little. This is a moderate amount in this patient. I'm now cauterizing the fat in the compartment. We don't want any blood vessels to break loose and bleed later on. This could create problems post-operatively. Here I'm just going through the wound bed again and making sure that every little spot is dry. I think that gives a much better chance of minimizing the post-operative swelling and bruising. I've now placed a skin hook at the outer edge of this the incisions, and now I'm going to close from medial or the middle part towards the nose to lateral. We use a very fine monofilament suture. People use different types of suture. Some people use absorbable suture here. I think there's a bigger risk of creating suture marks as absorbable suture is more reactive in the skin. This is a very fine monofilament, and we leave it in 5 to 7 days and remove it. Again, I want these edges to be perfectly matching and slightly averted, which they will be because of how I pass the needle and hold the skin edge up with each pass of the needle, and also because of the beveling I've done while making the incisions. I think that lower edge there was a little bit beneath the upper edge, and I really want this to be perfect, so it's no problem to back the needle out and replace a stitch. If it's going to make the closure more perfect, I'll do that every time. It's not a problem. Here in the left upper lid is difficult to see, but we're doing the same exact thing, removing now the skin and orbicularis muscle. And now we can see from the top view, I'm using the bipolar cautery again, just ensuring that the bed is dry. Every tiny little bleeder is cauterized. The fat compartment has been exposed and teased out, and now we're going to clamp it and trim it, and then again cauterize it, make sure there's no bleeding. And then the closure is just the same as in the right lid. We're going to post some additional videos in this very kind and cooperative patient who agreed to share her surgery with you. We're going to show her lower lids and cheek surgery, mid-facelift surgery, and we'll follow up with more information about that. Thank you.
Hi, my name is Ricardo Rodriguez, and I'm the Medical Director at CosmeticSurge.net. Today we're going to talk about the eye lift versus the brow lift, so that you understand better why I choose most of the time a brow lift. I'm going to explain to you why I choose the brow lift. The first thing a patient does as they start getting older is they start narrowing the focus of their eyes and closing this concentric muscle to focus the light better on their eyes. This causes a drop in the brow, and it's very gradual. And the first thing you notice is that you have a little bit of excess here of skin, and it's more noticeable when the patient gets tired or at the end of the day. And as a matter of fact, people will tell me I have this tired look. Now, after a while, when the brow has been down for a while, the excess skin starts putting weight on the eyelashes, and then there's a reflex where you start pulling back on the brow, and then you start creating these lines. Therefore, the solution to both problems is to put the brow where it belongs. Now, if you lift the brow gently to where it should be, right above the brow bone here, you notice two things. Number one, her whole face gets a more refreshed look, because the first place people look at is the eyes. Secondly, there's no longer any excess skin. So even though I did not touch the skin in the upper eyelids, that improves. Finally, when the brow rests in here, these lines will disappear naturally. For me, the brow lift is really the new eye lift. Technically, the procedure is done very non-invasively with very short downtime, which will give a very refreshed, natural looking result.
Hi, I'm Dr. Young. We're doing some liposuction today, and we're going to demonstrate this on one of our patients and during a lipo procedure. And what we're going to do is just sort of explain the reasoning behind liposuction. Well, one thing I usually do is when I take a look at someone, I have them sort of show me their teeth and see, and I want them to flex the muscle on the outside to see what is neck laxity from the muscles, or whether the what we're looking at in the neck, whether it is laxity or if it's extra fat that we can suction. When you show your teeth, you tense that muscle, the platysma muscle that goes from the base of your neck to your jawline. And if you flex that muscle and it's not, if it's lax, you're going to see it banding in the neck. And if your neck laxity is from that, then what you might benefit from more would be a neck lift, which is more of a procedure where you actually have to work in the muscle underneath. However, if you show your teeth and your neck laxity is not showing those banding of the muscles, and it's mostly not really mobile and it's mostly assessed to be due to fat, that's when you can benefit from liposuction. And what we're doing now is what I'm going to show you is the liposuction cannula. This is a really small one. We have 3 different sizes, and the size that we're going to mostly use is this really small one, and around the lower part of the face we'll use an even smaller one just to be really accurate in terms of how much we take. And it also allows us to be more conservative in the face using this really small cannula. And what we're going to do right now, what we show here is we've demarcated the area that we're going to do the liposuction. And what we're going to do now is just turn on the liposuction cannula. It's going to be a little loud, but I'm just going to show you a little bit about the liposuction in this area. Can you turn on this section, please? And we've already sort of expressed or developed the plane that we're going to suction. And we'll just do a few passes like that and just get a little bit of the fat. And in the tubing, you'll see the extra fat come through. And we're going to keep doing this until we get a better contour in the neck here. Reassess that after we do an initial pass there. And so we have to get in the right plane first, because we have to assure a certain layer of fatty tissue under the skin, so it doesn't get so we don't take out too much fat. So we're going to continue doing this until we get the right contour in this area, and then we're also going to do some more on the sides of the lower face as well as the side of the neck, and that essentially explains liposuction.